1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer in their lifetime, so knowing the causes matters. Let's look at 5 major causes you should know. Before we jump into the causes, quick definition. Cancer happens when normal cells lose the body's usual controls, acquire genetic mutations, and start multiplying uncontrollably. Those growing cells can form tumors. Some stay local, others invade and can spread to other organs. Now, 5 common causes explain simply why they raise risk, and 1 practical step you can take to reduce your risk. Cause number 1. Genetics. Some people inherit mutations that significantly raise their lifetime cancer risk. These account for a portion of cancers. Think families with strong histories of breast, colon, or rare childhood cancers. Inherited faulty genes can remove normal growth checks inside cells, making it easier for tumors to form. Know your family history. If cancers cluster in your family, talk to a clinician about genetic counseling and screening. Earlier and more frequent checks can catch problems when they're most treatable. Cause number 2. Environmental chemicals and carcinogens. Everyday exposures, certain industrial chemicals, contaminants like PFAS, carcinogens in processed and charred foods can increase cancer risk over time. These chemicals can damage DNA or disrupt hormones, increasing the chance mutations stick and cells begin to behave abnormally. Limit exposure where possible. Avoid known contaminated water sources. Reduce consumption of heavily processed and charred grilled meats. Check product labels for known harmful compounds. And follow local health advisories about water or air contamination. Cause number 3. Lifestyle factors. Smoking, heavy alcohol use, obesity, and diets high in processed foods and added sugar. These are among the largest contributors to many common cancers. Smoking introduces carcinogens that directly damage DNA. Alcohol stresses the liver and GI tract. High sugar, low fiber diets and obesity create hormonal and metabolic environments that promote growth of mutated cells. Cancer cells often take up far more glucose than normal cells, and excess sugar, insulin signaling can fuel their growth. Quit smoking and limit alcohol. Shift toward whole foods, more fiber, less processed sugar, and maintain a healthy weight. Small sustained changes here produce real reductions in risk. Cause number 4. Viruses and infections. Certain infections raise the risk for specific cancers. For example, HPV increases cervical cancer risk. Hepatitis B and C increase liver cancer risk. Epstein-Barr virus links to some lymphomas. HIV-associated immune suppression raises risk of several cancers. Viruses can insert genetic changes, cause chronic inflammation, or suppress immune surveillance, all of which can allow abnormal cells to grow unchecked. Vaccination where available, HPV, hepatitis B, safe practices to reduce transmission, and regular screening if you're at risk. Early treatment of chronic infections also lowers long-term risk. Cause number 5. Certain medical conditions and prior medical treatments. Chronic inflammatory diseases raise colon cancer risk. Some genetic syndromes require specific management, and in some cases, certain chemo drugs or radiation, while life-saving, can slightly raise the risk of a different cancer later. Long-term inflammation accelerates mutation and promotion of abnormal cells. Some therapies are toxic to DNA and can be a later risk. If you have a chronic condition, stay on recommended surveillance plans. Discuss long-term risks and screening schedules with your care team. Where possible, modern therapy planning aims to minimize late effects while treating the primary disease. To recap, the 5 common causes we covered are genetics, environmental chemicals, lifestyle diet, infections, and certain medical conditions or past treatments. Not all cancers are preventable, but many risks can be reduced. The point is, information equals power. The sooner you act, the better your chances of prevention or early detection. If you take 3 practical steps today, they would be: know your family history and talk to a clinician. Quit smoking, reduce alcohol, eat more whole foods, stay active. Keep up with recommended vaccines and screenings. If this helped you, like and subscribe. It really helps us get more evidence-based info to people. Got questions about a specific risk or want a deeper dive on one cause? Drop it in the comments and I'll respond. Thanks for watching. And remember, understanding risk is the first step to taking control.